To start here, good morning. Thank you all for coming today. I also want to thank Progress Ohio for allowing us to use their space today, and a very special thanks to Brian Rothenberg and his great staff for all their technical help in making this video conference possible. My name is Dale Butland. I am the Communications Director for InnovationOhio. I'm joined here this morning by IO's President, Janetta King, and by Professors Maxwell, Mehlman, and Jessie Hill of the Case Western University School of Law, who are with us via video hookup from Cleveland this morning. Not able to be with us today is Tara Goodnight, the Policy Director of InnovationOhio, and who had a big hand in putting together this research and report. As all of you know, this November, Ohioans will be voting on 3 ballot initiatives. One of them, the Ohio Healthcare Freedom Amendment, will appear on the ballot as Issue 3 and is a proposed amendment to the Ohio Constitution. Now, amending the Constitution is very serious business, and yet very few Ohioans, and probably very few members of the news media, have actually read the full text of this proposed amendment. You've probably read summaries of the amendment and probably the text of the ballot language. But that's not the same as the actual language that would be added to our Constitution if Issue 3 were to be passed by the voters. Specifically, Section 21C of the amendment, which contains the definitions that cause all the problems that we'll be talking about today, is not contained in the ballot language. There, only Sections 21 through A through D are there, but 21E is the key, as we'll be hearing shortly. Now, until recently, none of us had read the full text either. But when we did, we were absolutely shocked. Because while the sponsors of Issue 3 were doubtlessly aiming at the so-called individual mandate contained in the Affordable Care Act passed by Congress last year, our analysis found that they ended up hitting dozens of other laws and regulations that Ohioans depend on to keep us safe and healthy. Let me be crystal clear. The so-called Ohio Healthcare Freedom Amendment is so carelessly written and ambiguously worded that it would threaten a wide range of already existing Ohio healthcare laws, programs, and policies, all of which have been enacted and are supported by Republican and Democratic office holders alike. In that regard, I'm reminded of something that Issue 3's campaign manager said when he and I debated his amendment a few weeks ago on a public television show here in Ohio. He mentioned that the state of Massachusetts passed a health care reform law a number of years ago under Governor Mitt Romney, a law that he, the campaign manager, evidently doesn't like very much. Passing Issue 3 in Ohio, he said, would ensure that Ohio can never become Massachusetts. But when you look at all the currently existing Ohio laws and policies that Issue 3 would threaten, invalidate, or make unconstitutional, it's clear that Ohio becoming Massachusetts isn't the problem. The problem is that if Issue 3 is passed, Ohio can't continue being Ohio. In a moment, Janetta King and Professors Mehlman and Hill will walk you through our analysis and identify a few of the most important laws, programs, and policies that would be affected by Issue 3. For now, let me say that putting such a carelessly conceived and sloppily worded amendment into our state constitution would be an unmitigated disaster. It is bad law, bad policy, and bad medicine. And as the law professors will explain, Issue 3 would also spawn so many legal challenges and lawsuits that it could reasonably have been subtitled the Lawyers' Full Employment Act of 2011. And in these difficult economic times, can we really afford to be wasting hundreds of thousands or even millions of dollars on unnecessary lawsuits? For all these reasons, we urge every Ohioan to carefully read the text of the amendment before going to the polls, and then to protect themselves and their families by voting no on Issue 3 this November. Frankly, it's not a law Ohio can live with. And now let's get specific. First up will be the President of InnovationOhio, Janetta King, who will go through the first 3 provisions of the proposed amendment and identify a number of the already existing laws, policies, and programs that would be affected. Following that, Professors Max Mehlman and Jessie Hill will discuss Issue 3's exception provision and explain why it can't be counted on to save the day or to reduce the threat to existing laws and programs.